The World Health Organization's Regional Office for Europe has released a very comprehensive report named Artificial Intelligence is Reshaping Health Systems, State of Readiness Across the WHO European Region. They surveyed 50 member states to benchmark exactly where we stand in terms of policy, law and technical capability. So the ambition reflected in the report is really significant. It's not about isolated pilot projects anymore. The World Health Organization has structured their analysis into 6 specific pillars, from governance to workforce requirements, showing that the member states recognize AI as a systemic requirement, not a luxury. The intent is to move from experimental phases to national scale implementation. However, the data does reveal a stark contrast between that intent and the reality. The central hurdle here is what the report terms the gatekeepers, specifically the barriers to adoption. A striking 86% of member states cite legal uncertainty as a major barrier. This is the paralysis point. Innovators are building tools and clinicians are ready to test them, but the legal frameworks regarding liability and accountability simply aren't there. We are attempting to integrate autonomous systems into highly regulated environments without a clear rulebook. So let's break down the report's findings across the World Health Organization's 6 thematic sections that they produce, because the devil's in the details. And they provide specific terms for how they conceive these 6 concepts. So first are the navigators. This looks at strategy. While 66% of countries do have a national AI strategy, these are mostly broad cross-sector documents. But crucially, only 8% have a health-specific AI strategy. This suggests that most countries are treating health AI as a generic tech issue rather than a complex clinical safety issue. Second, what they term the change makers. This covers stakeholders and workforce. The report identifies a significant gap here. While governments and developers are talking, patient associations, the public, are largely excluded from the conversation. And furthermore, workforce readiness is low. Only 24% of countries offer in-service AI training for healthcare professionals. We're effectively asking clinicians to fly the plane without a credible flight school. Third are what they term the guardrails. This addresses regulation. The legal environment is very fragmented. 46% of countries assess their current laws have significant gaps regarding AI. Most concerning is the lag on emerging tech. Only 6% of countries have introduced legal requirements specifically for generative AI, despite its rapid uptake. Fourth, they term the backbone. This is data governance. The infrastructure is actually improving. 66% of countries have established national health data hubs. However, the governance of that data is lagging. Only 30% have clear guidance on the secondary use of that data for research. We're building the libraries, but keeping the books locked away from being able to learn meaningful information that will improve care for patients. Fifth are the catalysts. This examines priorities and uptake. The top priority for member states is improving patient outcomes, followed closely by reducing workforce pressure. In terms of actual usage, AI-assisted diagnostics is the leader, present in 64% of countries. However, there is what they term a funding decoupling of the countries that have identified strategic priorities. Only half have actually allocated the funding to achieve them. And finally, the gatekeepers. As mentioned, legal uncertainty and financial affordability are the primary blockers. The report notes that 92% of countries believe clear liability rules would be the single most effective policy enabler. So how do we move forward? We can't wait for a harmonised pan-European or global legal framework to be perfected. That will take too long. The bridge, I think, to success is a regulatory sandbox. The report highlights the UK's AI airlock, a partnership between the NHS and regulators, as a kind of example case study. We need more of this. Member states should establish controlled environments where liability is contained and oversight is intense, to allow us to generate the safety data required to write laws, rather than waiting for the laws to be written before we generate data to base them upon. And furthermore, regarding the workforce, clinical leaders must take up the initiative. We can't wait for national curricula to catch up. Hospitals and medical societies need to start thinking about how to integrate AI appraisal, the ability to critique an algorithm's output, into kind of standard medical education. And I think more broadly, the proof of readiness is not in the number of algorithms that we procure, but in the robustness of our governance. The World Health Organization report acts as a sobering baseline. It shows a region that's technically capable, but legally and operationally unprepared. We have the pilots, what they term the catalysts, and the infrastructure, the backbone, but we lack the training, the change makers, and the rules, the guardrails, in order to implement it with confidence and safely. We shouldn't necessarily be focusing solely on the technology. A top priority for the next 12 months or so must be legal clarity in a regulatory environment so people can implement these tools confidently and safely. Without these two pillars, we remain in a state of perpetual pilot studies without making kind of real transformative progress.